tennis. We are continue talking about the anatomy and about the feet and ankle. So we were talking a little bit in one of the videos about the flexors muscles of the feet, about the ankle, anatomy, bones. So we continue talking about the area of the extensor muscles. So we were talking about the dorsal area of the ankle. So we are talking about, if you see the anatomy, you can see, for example, in this picture, we can talking about the extensor digitorum longus, or we can find as well extensor digitorum brevis. So when we're talking about the word digitorum, is because we are talking about these toes, you know, different than the alluxis, that is this big one, okay? So this is the digitorum. When we're working about the longus, is because the tendon of the muscle is going until, you know, the head here, or the last part of the phalangeal that I showed you in the bones. And when we're talking about the digitorum brevis, is because it's not going until the end of the feet. It's going, you know, the same the phalangeal, but maybe of the base of the phalangeal, not the last part of the phalangeal that is here, the distal part. So this is the general difference, no? And the function, of course, if it's extensor, is because extends, you know, the feet, the toes. Because we can talk as well about the extensor or dorsiflexion of the ankle, because could be the extension of the ankle, but the word that the terminal is dorsiflexion. So when we're talking about dorsiflexion, we want to talk about the tibialis anterior. Tibialis anterior, I will show you that is the muscle that is coming from the knee, all the anterior side and medial side of the, you know, here of the leg. Okay, so this muscle, the tibialis anterior, is the muscle that is in charge of the, let me show a little bit in my body the movement. So is in charge of the dorsiflexion and eversion. The movements of our body in our ankle, is dorsiflexion, plantar flexion, eversion, and eversion. So when we do dorsiflexion and inversion, this movement, the tibialis anterior is in charge of this movement. When we do plantar flexion, we are talking about the gastrocnemius or gastrosoleus. And if I talk about dorsiflexion and eversion, I'm gonna talk about the fibularis. Why fibularis muscles is in the lateral side of the leg, and if fibularis because it's attached of the fibula, that is the name of the bone that is in the area. Fibula, tibia, so tibialis here and fibularis here. So we continue talking here. So this is here, we can see the tendon of the tibialis. The muscle is coming from here. The tendon is the ending side of the muscle, okay? And here I told you always the alluxis, that is the big toe, it have his own muscles. So this is the extensor of the alluxis longus, because it's coming, you know, until here. This is the name longus. Okay, let me show another things that we can, or we talk about as well. We can talk when you see the feet, you can talk about extrinsic and intrinsic muscles. So I'm gonna explain a little bit about that, because when you talk about intrinsic muscles, let me, okay, show a little bit. Okay, I have some picture here. Okay, here it is with picture. I'm gonna show this picture because I'm gonna mention what is intrinsic and extrinsic muscles. Intrinsic muscles are small muscles that is in charge of keep the arc of our feet. Our feet in the middle side, we can see this arc. So when these intrinsic muscles and all the tendons and ligaments that are here under the feet in the plantar area are weak, so this arc is gonna be flat, you know, it's gonna be through the floor. So when the feet is flat, can cause problems not only here in the feet, can cause problems on the ankle, knee, hip, and vertebral column. Even neck as well can cause problems. So the intrinsic muscles, remember, small muscles that are here in this area and are in charge of keep the good arc in the feet. And the extrinsic muscles are the big muscles that I mentioned before that are in charge of the plantar flexion, dorsiflexion, eversion or eversion of the feet. So this is as well, you can find that intrinsic muscles are in charge of the weight bearing of our body. This is why, you know, in charge of have this arc very well here in our feet. If get flat, we get sick as well. So this is I want to mention the intrinsic and extrinsic muscles. So now we can talk about little bit about the innervation. Remember I told you when I talk about face and head muscles, I told that since the vertebral column, you can see the medulla is inside, and from the medulla, you know, the nerve is coming and go to all the body, go, you know, giving the electricity or the movement of the body. So here I'm gonna see part of the innervation. So when you talk about the innervation of any part of the body, you have to know very well what is the name of the nerves or of the branches that coming from the vertebral column. If not, it's gonna be a little difficult or confused. So we talk about the innervation of the plantar side of the feet. We can see, for example, I talk about the branches, you know, so the branches is because it's coming from up from the leg or for the lower side. It could be coming from the lower part of the vertebral column, lumbar and sacral side. From this area coming all the nerves that are gonna innervate our legs and our feet. So if you see, for example, here in this area, the green one, say lateral plantar nerve is the branch of the tibial nerve. So why tibial? Because it's the nerve that is coming and pass from the area of the tibial bone and tibial muscle, but coming always from the lumbar or sacral side. Here in this area, so we can see the sural nerve. The sural nerve is the branch that comes from the fibular and tibial nerve. So we can see here that the tibial and fibula are innervate for the same branch in this part, and is coming innervate this area of the feet. So this is why you have to have very good knowledge about the innervation, about all the nerve and cranial nerve. It's very important, because if not, it's gonna be a little bit confused. Here is just something general. So median plantar nerve is almost all the feet, and is the branch of the tibial nerve. If you see here, and it's more easy for you, almost all the branches coming from the tibia and from the fibula, that is the bones of the legs, but low part of the legs. Saphenous nerve is the femoral nerve, is the only part that is coming from the up area of the leg of the femur. So of the femur coming this branch that is gonna innervate just little part of the feet. And here in the calcanea, medial calcaneal branch, that is coming as well from the tibial nerve. So we can see that almost all the plantar of the feet is innervate from the branch that is coming from the tibial nerve. Tibial nerve because pass or go or innervate, whatever you is good for you learn, the tibial area, tibial bone, tibial muscle, all the where is the tibia. So if you see, almost all coming from the tibia. So this is the innervation of this area. It's many ways that you have to learn the innervation. It's a little bit complicated, but it's not impossible to learn. So let me show another that maybe it's a little bit okay, easy to learn. Okay, here for example, both areas, plantar and dorsal. So we can say, I just show you this area. So we can see the dorsal area. So the dorsal area, if you see For example, number 2 is the peroneal nerve. Number 3 is superficial peroneal nerve. So I just mentioned that because if you see the plantar surface, almost all the innervation is from the tibial nerve, and the dorsal side, almost all the innervation is coming from the peroneal nerve. Remember, peroneal refers from the fibula, our area of the fibula. So it's easy to remember in this way. Here tibial nerve and here peroneal nerve. So you can see here. For example, just one